His Excellency, the President of the Republic of Botswana, Dr. Eric Masisi, Her Excellency, the First Lady of Botswana, Mrs. JANE MASISI, Honorable Ministers, members of the Diplomatic Corps, distinguished partners and healthcare providers, Merck Foundation alumni of Botswana, distinguished media partners, and Merck Foundation award winners. Ladies and gentlemen, I'm extremely pleased that we have two distinguished guests attending our meeting today. His Excellency, the President of the Republic of Botswana, and our long-term partner, Her Excellency Mrs. JANE MASISI, the First Lady of the Republic of Botswana and Ambassador of Merck Foundation More Than a Mother. Today we will officially launch the different Merck Foundation programs in the country. And by this, we will underscore our commitment towards building healthcare and media capacity, patient care landscape, transformation, ending GBV, breaking infertility stigma, and supporting girls' education in Botswana. Our close partnership with the First Lady of Botswana began already in 2018, and over the years we have achieved many important milestones. I'm proud to share with you that Merck Foundation has since then provided 45 scholarships of 1-year online PG diploma and 2-year master's degrees for local doctors from Botswana. So we have trained doctors in underserved and critical medical specialties, such as oncology, diabetes, endocrinology, embryology, fertility, sexual and reproductive care, acute medicine, dermatology, obesity and weight management, respiratory care, and internal medicine. My colleague Dr. Rasha mentioned that figure before, 45 scholarship, but of course we have to put it in relation to the population of 2.7 million. So it's a very high number we already trained, given that in some of the bigger, much bigger neighboring countries of a population of 55 to 60 million, we only trained 150 to 180 doctors. So we achieved a lot already in Botswana. The objective of the scholarship programs is to contribute to advancing healthcare capacity with the aim to establish a strong performance and platform of skilled and specialist healthcare providers across the whole Republic. We strive to improve the overall health and well-being of people by building healthcare capacity across Africa, Asia, and other countries as well. So we are committed to transforming the patient care landscape through our scholarship programs, and it works. We strongly believe that empowering people will lead to a better future, and also we believe that good healthcare can transform the lives of individuals and families across developing countries. It will significantly contribute to economic and social development because healthcare is a major driver of economic growth and consequently of social progress and increasing the wealth of a country. We all know that the lack of financial means is not the only challenge in Africa, but the scarcity of trained healthcare personnel capable to tackle disease prevention, diagnosis, and management at all levels of the healthcare care system. This is the biggest challenge. The sweeping shortage of medical and healthcare manpower is a crucial limiting factor, not only in Botswana but around the world. As per the WHO 2017 report, unfortunately we do not have earlier figures or later figures, Africa had just 168 medical schools in the entire continent. Only one medical school in 24 countries and no medical school in 11 countries. Sub-Sahara Africa, with 24% of the world disease burden, has only 2.8 healthcare workers per 10,000 capita. This is compounded by the maldistribution of workforce among rural and urban areas, and the public and the private sector. For example, before the start of the Merck Foundation programs in 2012, there was not a single oncologist, fertility specialist, or diabetologist in many countries. In countries well known, such as the Gambia, Liberia, Sierra Leone, Central African Republic, Guinea, Burundi, Niger, Chad, Ethiopia, Namibia, Myanmar, and Bangladesh. Furthermore, these countries have either no or very limited specialized doctors in many specialized critical fields. Therefore, till today, Merck Foundation has provided more than 1,810 scholarships for young doctors from 52 countries in 42 critical and underserved medical specialties. Many of them are becoming the first specialists in their respective countries. Dear partners and alumni, I'm very happy to meet you today, to hear from all of you later on your success stories and experience gained from these training and these educational programs. I congratulate you all. I know many of you have already graduated and the rest are now undergoing their scholarships successfully. We appreciate that you are taking your study seriously, as it will significantly contribute towards your own personal future career, but also towards the quality of your practice, hence will further continue to contribute to improved patient access to equitable and quality healthcare in Botswana, and it will help to improve the general healthcare landscape in the country. Today, we are also meeting and recognizing the winners of the Merck Foundation Media, Film and Song Awards from 2020 to 2024. Well done. Happy to meet you all. I'm very proud of you all that you did it. We at Merck Foundation believe strongly in the critical role that media and art plays to create a cultural shift and to address all social and health issues in our communities and to shed a lot of light to everybody that we have the ability to improve our lives further. So let us all work together to transform the patient care landscape and raise community awareness about sensitive and critical health and social issues in Botswana and across other African countries. I'm looking forward to meeting you all again in the near future to celebrate your success stories after the rest of you will have graduated later on this year. I'm also very happy to launch our Educating Linda program in close partnership with Botswana's First Lady to support girls' education through providing scholarships and bicycles for 40 schoolgirls to cover their transport and other educational expenses. So I tested one of the bicycles myself yesterday, and I tell you, they're really first-class bicycles. So that will help the girls to reach their potentials and achieve their dreams. And I'm sure this program will be a great success as well. Last but not least, I would like to thank again the Excellencies, the President and the First Lady of Botswana, for the great hospitalities we are enjoying during these visits and the continuous ongoing support, which is enormously important for our work here in the country. I would like to emphasize our commitment towards our long-term partnership with you. We are looking forward to scale up our efforts to provide more scholarships and more healthcare for more healthcare providers in Botswana. So, we are very proud to work closely with the First Lady of Botswana and the government to contribute towards the health and social development of this beautiful country. And I'm personally, I must say that, give me the chance to say a personal word, very happy that we have already achieved such a lot, and without the support of the First Lady and the President, and of course also the ministries, we could never have achieved it. So thank you very much for all of that. Thank you.